More than 25 years ago, Professor Twardowski discovered that repeated cannulation of the exact same puncture sites was a successful puncture technique in patients with an arteriovenous fistulae. This method of constant site puncturing was later called the buttonhole technique. Here one can clearly observe that this patient, who has dialyzed for several years, has only two puncture sites, one arterial and one venous. The goal of this video program is to familiarize the practitioner with the technique, to promote it, and to show the 4 different steps for a successful result. The first step consists of carefully choosing both the arterial and venous cannulation sites. The procedure starts by an evaluation of the fistula. We have to check through observation for evidence of inflammation surrounding the fistula, oedema or swelling, drainage, pain and signs of aneurysm. Through palpation for the presence of blood flow through the excess, and through auscultation on the sound and direction of flow. We will subsequently look for healthy and, if possible, straight areas which are easy to cannulate. Preferably, a distance of 8 centimeters between both cannulation sites should be respected. The second step of the technique consists of the very first puncture. Start by thoroughly disinfecting the cannulation site. Apply a tourniquet and palpate the vessel to be cannulated. The cannulation is performed with a normal sharp fistula needle at an angle of at least 25 degrees. Tape the needle and check for the flashback of blood. It is mandatory that the cannulation site selection and the first cannulation are performed by experienced practitioners, as the success of the technique will greatly depend on it. After the first session, needle removal should be performed at the same angle as the insertion angle. Apply pressure to the site when the needle is removed entirely. When hemostasis is achieved, disinfect the cannulation site thoroughly and gently slide the Biohole plug, a thumbtack-shaped polypropylene peg or pin, towards the vessel, along the same path as the puncture needle that has just been removed. Keep the plug in place with sterile tweezers while the holder or support unit is being removed. The Biohole plug facilitates the creation of a scar tissue tunnel track and allows easy recannulation, respecting the same insertion angle. A compressive dressing covers the plug. The plug will not be removed until the next session. As will be shown, a Biohole plug will be systematically used until at least the 6th dialysis session. It is permitted to shower during the creation of the scar tissue tunnel track with the Biohole plug, so long as a plasticized, hermetically sealed dressing is used to protect the puncture sites. The third step of the puncture technique consists of the creation of the tunnel track. The procedure will be performed from the second session onward until at least the 6th. A longer utilization of the Biohole plug may be necessary in some patients. First, remove the dressing. Gently disinfect the skin and the cannulation site. With care, using a gauze swab or sterile tweezers, remove the Biohole plug. It is important to re-disinfect the puncture site at this stage. Hold the skin taut without pulling, while carefully sliding a specially designed blunt needle called the Biohole needle, through the track left open by the Biohole plug. It is important to remember to insert the needle into the exact same spot as the first cannulation, remembering that the angle of insertion must be the same to continue the establishment of the scar tissue tunnel track. There is a possibility of the Biohole needle bouncing off the vessel wall and/or penetration of the Biohole needle tip into the vessel being difficult to achieve. As mentioned already, it is preferable to use the Biohole needle from the second cannulation onwards. If moderate resistance is met, pull the needle back a few millimeters, rotate it gently while you push it forward, using some light pressure. Please note that it may not be possible to insert a Biohole needle during these first sessions. As a second option, having tried a Biohole needle, a sharp needle may be used with caution. Always secure the needle. The next procedure will be performed at the end of the second treatment until at least the sixth session. Remove the needle at the same angle as the angle of insertion. Apply pressure to the site when the needle is removed entirely. When hemostasis is achieved, disinfect the cannulation site thoroughly and gently slide the Biohole plug towards the vessel along the tunnel track. A compressive dressing covers the plug. The plug will not be removed until the next session. It is permitted to shower during the creation of the scar tissue tunnel track with the Biohole plug, so long as a plasticized, hermetically sealed dressing is used to protect the puncture sites. From the seventh session onwards, the routine buttonhole puncture technique may be implemented. After the first disinfection of the skin, any scabs over the cannulation sites have to be removed. A 19-gauge needle can be used for this procedure. Removing the scabs completely is mandatory in order to visualize the tunnel entrance and to avoid infection. This might be difficult and time-consuming. In order to facilitate the removal of sticky scabs, soak the puncture sites for a few minutes with saline. To remove deep scabs, introduce the needle tip with caution into the tunnel entrance and lift the scab, avoiding damage to the surrounding tissues. The second disinfection of the puncture sites must now be done. Slide the Biohole needle gently into the established tunnel track. There is a possibility of the Biohole needle bouncing off the vessel wall and/or penetration of the Biohole needle tip into the vessel being difficult to achieve. If moderate resistance is met, pull back the needle a few millimeters. Rotate it gently while pushing it forward, using some light pressure. As a second option, after having tried a Biohole needle, a sharp needle may be used with extreme caution. First, remove the tape. Then remove the needle at the same angle as the angle of insertion. Apply pressure to the site when the needle is removed entirely. Continue by thoroughly disinfecting the cannulation site and cover with a dressing.